Ladies and gentlemen, it's our pleasure to participate in the International Environmentally Friendly Hospital Team Work Best Practice Award for 2015. We would like to share our experience about how to provide care without harming the environment and to reduce energy consumption for a sustainable future. Today, we would like to cover all the prospects within this presentation. Starting from a brief review of the development of green policy nationwide, what's the role of leadership in the Taiwan Adventist Hospital, and how the organization identifies and responds to related issues, actions we took, and the outcome we got, the special feature in Taiwan Adventist Hospital, and our future prospects. First of all, let's think about where the concept of energy saving came from and why it is so important for us to become a low-carbon hospital. As we all know, a hospital is a high-energy enterprise with its bright lights, refined air filtration, stable temperatures including intensive heating and air conditioning, heavy-duty imaging devices with highly complex manufacturing histories, exotic chemicals, and the need to keep everything clean, disinfected, and purified. As many contraries had already realized that immediate actions must be taken for this crisis. The first wave of healthcare greening arose in the 1980s with attention to such practices as cleaner manufacturing methods and reduction in waste volume. The second major wave has been driven by the movement to reduce the environmental footprint of buildings. In 2006, Taiwan became the 32nd member of the WHO Health Promoting Hospitals and Health Services Network. Furthermore, the Taiwan Adventist Hospital had been certified as a member of HPH Network since 2007. On the other hand, a global vision of environmental health for the evolution of international standards in energy management. For environmental sustainability, more and more countries have evolved into this global trend to foster a green economy. Meanwhile, we not only comply with the government's policy and regulation, but also participate in programs led by the Taipei City government for the purpose of providing the environmentally friendly and holistic health care. In order to create a long-term organization culture change, leadership has been placed on the top of the list in the following agendas. Since the Taiwan Adventist Hospital was established in 1955, for over 60 years, with our expertise, enthusiasm, and love for serving the community, we actively promote healthy living with our New Start project to improve health conditions by providing education in healthy lifestyle for reducing the waste of medical resource. As a member of the Adventist Healthcare Association, we have 11 Adventist hospitals in Northern Asia Pacific Division, and we also have several affiliated organizations under the denomination of the Seventh-day Adventist Church in the U.S. We have been forming an association across the division to share our experience with each other in our annual President Council. It had been stated very clearly that the Taiwan Adventist Hospital aims to provide holistic care and is devoted to health promotion as our mission and vision. For short-term to long-term goals, we keep moving forward to this direction. We will target to incorporate health promotion concept within the organizational culture as the routine workflow in 2017 to 2018. And then we will cover the issue of to foster our professional teams with credit of high integrity for corporate sustainability in 2019 to 2020. To carry out our mission, we conducted an Energy Management System Committee to integrate action plans across each department. We are continuing to renew our guideline based on the national standards and review our plan every 2 years for merging the idea of going green as a lifestyle in the culture of Taiwan Adventist Hospital. To address the role of leadership, the Energy Management System Committee serves as the core team to lead the strategy of carbon reduction hospital-wide and to draw every unit's attention to reaching the goal setting in each milestone. In the following slides, we would like to introduce actions that we take in 4 major areas, from energy saving, waste reduction, purchasing and building, to how we are devoted to creating healthy lifestyle promotion activities step by step. Energy saving is the most important key element in the whole project. we build the energy management system for becoming a global green and healthy hospital, with continuing monitoring, measuring, and improving through PDCA circles. Members in the Energy Management System Committee came from unit representatives in clinical, administration, and purchasing sectors, with related experts' participation, such as IT, maintenance, and medical engineering, to assist in a comprehensive calculation and analysis of the energy consumption, and the President and VP of Finance were appointed as leaders to supervise this committee to reinforce the concept and efforts we are eager to address about energy consumption throughout the whole hospital. By using a regression model, we developed an energy consumption goal from 2008 to 2010, with 36 months consumption data in total. In this analysis, it shows that there are two major factors that contributed the most. One is the outside temperature, and the other is total clinical visit volume. Therefore, we calculated our energy baseline according to the formula of energy consumption per units is energy consumption per unit equal to 15.3481 plus 1.1297 multiplied by temperature record plus 0.000341 multiplied by total clinical visit volume. We conducted the energy review analysis based on energy balance chart of the usage in thermal and electrical energy during 2011. In this slide, it shows the greatest consumption in our thermal energy is liquefied natural gas with 3,347,962.2 megacal in 2011, and about 94.49% had been used for hot water supply in wards and hot steam for disinfection. Therefore, we aim to reduce the boiler heat consumption as our major improvement project. Then, the next section is the usage of electrical energy. We are not surprised that the top two consumption of electrical energy are the air conditioning and lighting equipment, are almost up to 80% in total usage. Thus, how to redesign our air conditioning system and lighting equipment became our primary challenge. After several discussions, the committee members finally identified targets as the above. Based on the actual energy review, the hospital aims to reduce 3% energy consumption from 2011 to 2013. To prioritize those improvement projects, we selected the hospital-wide utility-related items for hardware updating, including replacing the old lighting system with LED lighting gradually, installing frequency converters for reducing the energy consumption of air conditioning system, placing inverters in cooling towers, and redesigning the hot water pipes to save more thermal and electrical energy. Also, in the tightly secured central monitoring room, the facility's operation is fully under control from energy consumption data collecting, accident responding, to hazardous events prevention. Whenever an unusual value setting has been detected, the central monitoring room can make the adjustment in temperature or air volume by remote control. In addition, we encourage our staff to raise their proposals from their daily work observation. It could lead to a systematic improvement. Those proposals will be ranked and be rewarded, for some of the good ideas will be followed up as an action plan, like what we list above, to set up sense lighting for energy saving, to have air conditioning timing control, and to substitute poster by mobile digital bulletin board. We analyzed the trend of decline in electricity and gas energy consumption compared to the energy baseline we created from data collection during 2008 to 2010. We successfully reduced 4% in the first year implementation, and then 0.6% reduction in the second year, and with 2% decreased from 2013 to 2014. Step by step, we were not only achieving our goal setting of 3% reduction, but we actually went over the total 6% energy saving for the past 3 years. And our second challenge is waste reduction. In Taiwan, incinerators are still the main vehicle used to dispose of medical waste. However, under the regulation, we still try to reduce the amount of waste dumping for burning by establishing the waste classification guideline to cut down waste incineration for reducing carbon emission. Other than proactively promoting the concept of garbage classification, we have internal inspection regularly, and we collect data from 2012 to 2014 that shows the total reduction of general waste, biomedical waste, and recycling material reached up to 20.74%, 11.15%, and 3.02%, declining. Other than recycling those general items, we also try to recycling waste batteries and reusing toner cartridges. Especially as we cooperated with the Parents Association for Persons with Intellectual Disability Taiwan, we donated the earnings from recycled batteries to help with the low-income group. Moreover, as a healthcare facility, we are more aware of the issue related to household pharmaceutical waste collection for preventing toxic pollution from leaking into our drinking water or causing environmental harm due to medicine dumping. In 2013, we started the process of electronization to cut down the usage of paper. From 2013 to 2014, we estimated that we were about 860,400 pages saved because of the medical system went for paperless in total. Other than reducing the energy consumption and medical waste, we take into consideration how to move forward for a sustainable future. From green purchasing to building remodeling, from daily supply material to major devices or equipment, we care more about if our decision would be consistent with our belief in sustainable operation. In order to carry out the goal of carbon reduction, green living, and green purchasing, our purchasing policy follows those national green trademark as the priority consideration during purchasing decision-making process. Also, the hospital consistently rules out device, material, and equipment which are not environmentally friendly. For example, we stopped using and purchasing mercury sphygmomanometers and chose to use environmentally friendly refrigerant. The second part of our green purchasing scale is larger than saving money since our hospital is made up of 2 buildings. These 2 buildings were 20 years apart. Therefore, when we talk about maintaining these 2 buildings for better efficiency, we could not skip considering the connection and interaction in between for identifying the potential effect that might occur after changes were made. We made a discrete evaluation to analyze what kind of impact might occur to our neighborhood during the operation. For example, the generator. A generator is a type of basic equipment for a hospital's daily operation, which could be used around 30 years. It is very important to consider the long-term environmental impact, which might be caused by using generators for decades. Therefore, we comply with regulations to eliminate polluted air emissions and to reduce the noise whenever we make a purchasing decision for equipment updating. Rather than selecting environmentally friendly product, we also reduce energy consumption by systematic design, such as improving the hot water supply system through the integration of motors and pipes to reduce gas usage up to 14.23%. Moreover, with a great amount of water usage in the dialysis center, we are reusing wastewater as toilet flushing water. Every day, we can save about 10 tons of wastewater just from the dialysis center. Besides optimizing, reducing energy and resource demands, the hospital responded to the local community and the environmental landscape as well. Since 1986, the green area near the hospital was classified as a city protective view site. We cannot have healthy people on a sick planet. As the statement in A Comprehensive Environmental Health Agenda for Hospitals and Health Systems Around the World, while we are working so hard to eliminate the pollution of water, air, toxic chemicals, the fundamental and ultimate goal is to keep people healthy by educating them with a healthy lifestyle. Therefore, a health promotion committee was established to foster the culture of health promotion. It provides a variety of health promotion activities, including enhancing international knowledge and experience exchange, to arrange health education section for public to realize how to remain their health status, and also the issue of reducing carbon emission is one of the key elements, which has been included in the committee meeting agenda. Beginning in 1955, this hospital has been devoted to preventative medicine and health promotion as our primary tasks. That's why we introduced the Healthy Living Style New Start program from the Seventh-day Adventist Church affiliated hospitals back to the U.S. with the 8 principles of life, including nutrition, exercise, water, sunlight, temperance, air, and trust in God, for achieving the goal of prevention of disease or to postpone chronic diseases. Beyond promoting a healthy diet and localized sustainable food systems, in Taiwan Adventist Hospital, we have more. Here is the brief review of New Start Diet Principle. The hospital offers our clients and employee veggie models without refined oil, refined sugar, low sodium, and high fiber. In the long term, we not only treat our clients with medicine, we teach them how to regain their health and reduce the cost of the carbon footprint at the same time. Globally, the food industry is contributing greatly to carbon emissions and climate change, especially in the process of producing meat and dairy production, and the hospital provides total veggie meals since 1974. In our affiliated restaurant, Taste of Nature, we provide a variety of natural vegetarian food, including a buffet in both Chinese and Western-style low-fat meal, salad bar, bakery, and postpartum meal. During 2013 to 2014, our staff servicing volume is increasing up to 21%. Meanwhile, the Department of Community Medicine offers various types of health education for different groups, from smoking cessation to weight loss. We humbly take this opportunity as a self-evaluation to review those green actions we take for carrying out our commitment to the public. With God's promise, we are committed to providing people with a conceptually innovative hospital. What we are doing now will lead us to where we will be going in the future. Over the past years, the Taiwan Adventist Hospital keeps moving forward to fulfill our vision of achieving the highest patient satisfaction and being the leader in preventative medicine, as well as participating certifications and introducing standards from those national organizations. Step by step, the idea of health promotion and preventative care were merged into the culture of our hospital. In the past 60 years, the Taiwan Adventist Hospital has already been developing a systematic model for sustainable operations. It is not only an attitude toward life, but even a social movement. As a healthcare facility, we do willingly create an environmentally friendly place with green operations to increase the harmonious interaction between communities. On this endless journey, we will continue using a healthcare system as an educational platform to teach people how to promote their health status, not only to keep people healthy, but also reduce the consumption of medical resources, reduce carbon emission and waste for saving the earth. In the next stage, we will focus on the hardware design and behavior change to build up the e-system service and encourage vegetarian diet for a sustainable future.